For those just joining us, we're speaking with Mercy's Chief Medical Officer and Head of Medical Affairs, Dr. Wilma Rowe, and Mercy Physician Assistant, Jess Hagner. In the first half of our program, we discussed your roles on the front lines relevant to Mercy's COVID-19 response, but now I'd like to talk a little bit more about your background. Dr. Rowe, you grew up in the suburbs of Washington, D.C., and felt that you, quote, kind of always knew that you wanted to be a doctor, as you told Style, but didn't head down that path right away. You graduated university with a degree in political science, and then you went into banking. Now, how did you get from political science and banking into medicine?
Yeah, I was the youngest of 4 kids, and my 3 older brothers, who we were very close, all went into banking. And I just sort of followed the family path into banking, but I had always been drawn from a very young age to things medical. The science of it just fascinated me, and the ability to help people really was of great interest to me. And so I did go into banking, and I really enjoyed my time in banking, but I had that pull always kind of tugging at me, and I got a little bit older and decided it was okay to sort of leave that family profession and pursue what I really always knew I wanted to do.
Jess, how about you? How did you wind up in medicine?
So I always was interested in science growing up. It was always my favorite subject in school. And I have family members who are in the medical field. My father is a physical therapist, and my grandmother was a nurse for many, many years. So I was always kind of exposed to medicine in that way. And when I got to college, I was kind of introduced to the profession of a physician assistant and what that concept was. And it seemed very appealing to me. Kind of in contrast, I kind of always knew that I didn't want to be a physician. I never really saw myself in that specific role, but I knew I wanted to do something in medicine. And being a PA just seemed to fit. So.
Now, what about outside of work? Things that you enjoy doing in your, what I like to say is your ample leisure time, which you really don't have. But, when you do have leisure time, anything in particular you like doing?
The vast majority of my free time outside of work is spent chasing around my 2 young children. I have a 2-year-old and a 5-month-old, so they take up a lot of time in the best way possible. But one of my other passions is baking. I really love to bake, and I like to challenge myself with new recipes, new techniques, that sort of thing, making special cakes or cupcakes for friends and family for special occasions. So I really enjoy doing that.
Is there something that you're known for? Like my cakes, my pies, my muffins, my breads?
Probably my cakes. I've done a lot of decorated birthday cakes for my nephews, and then I just did a big baby shark themed cake for my daughter's birthday in April. So probably my cakes. Mm-hmm.
Dr. Rowe, when you're not fighting COVID-19, what are you doing?
Well, many years ago, I chased around 4 sons, but more lately, I stay busy. I am always doing something outside of the hospital, and I think I always have a hobby du jour. I think my current hobbies are, I like to make things, similar to Jess. I like to make things, and I like to grow things. So right now it's gardening, tomatoes and cucumbers and herbs and asparagus and raspberries and everything you could think of, and I like to make things. So I make vinegar, I make soap, I make mugs and T-shirts and jam and anything you can think of. Again, I like to learn to make new things. So I'm always looking for, once I've mastered something, looking for a new hobby.
Reminds me, there's a saying about being a jack of all trades and master of none, and that's supposed to be an insult, but I always thought it was a pretty good thing to be, but maybe jack of all trades and master of some. But my thought was always that life is about the variety. to do different things. I mean, there's something always new happening in the medical field. There's another study, there's another breakthrough in research and so forth that's always making it interesting. Would you say that is correct?
Absolutely. I feel like especially in this job, well, in my direct patient care before, you kind of learn something new every day, but especially in this position, I've definitely every day I'm learning something new and different. So it's interesting to apply that to your everyday work.
Right. Or seeing a new journal article come out on some advancement in healthcare. It's like exciting. Yeah. And it is fun to apply that to work that we're doing here.
Well, as regular viewers of our program are aware, we typically feature a sort of show and tell, where guests bring in an item that bears some significance to them, whether reflective of achievement in their careers or in their lives, or just has some personal meaning for them. Dr. Rowe, let's take a look at what you brought us.
So I brought a picture, and this picture might look vaguely familiar because it's similar in location and style to a mural that you see when you're walking into Mercy. So that mural that you see on that wall there represents medical education and something that Mercy has always done. And this is a photo many, many years later. It's that same photo. It happens every year. This happens to be one that I'm in. There's me. We have years worth of these photos on the walls in Mercy. But this means a lot to me. This is more than just a picture on a wall. It's a representation of medical education, training the next generation. It's about service to our community, the pictures in the park. It's about a family. And so these photos and the collection of them are very special to me.
Well, for those of the viewers who don't know, Mercy is considered a teaching hospital and has had a very long relationship with the University of Maryland Medical School. University residents come through and they serve all sorts of different departments within Mercy, including OBGYN and emergency medicine and others, I believe. Mm-hmm. So as you mentioned, that sort of opportunity to see the next generation coming up
Right.
and seeing that going. And what have you brought, Jess?
So mine's a bit personal. So this is a crucifix that hung in my room as I was growing up, and now it hangs in my daughter's room. And it's special in that this is the crucifix that Pope John Paul II used throughout his papacy. And my family and I were fortunate enough to go to Rome when I was younger. My uncle was studying in the seminary to become a priest at the time and was stationed at Rome. And so we were able to go to a papal audience when Pope John Paul II was still Pope, and got the crucifix when we were there. And so it hung in my room growing up, and now has moved on to my daughter. So it's significant for that reason. But also, my daughter was born 4 weeks early in the very beginning of the pandemic, just months into the pandemic. And after she was first born, needed to be readmitted to the hospital. Pretty much the day we came home from the hospital, she went right back in. And because of COVID, my husband then could not be back in the hospital with us. So you can imagine, as a brand new mother, my first child, it was terrifying being by myself with her and seeing her attached to IVs and other things and not having my husband there. And one day when I was in the hospital and he brought me some things from home, this was in the bag. So this sat on top of her isolette every day until she came home, and now it hangs in her room. So it's very special.
Dr. Rowe and Jessica, thank you both for your time and your candor. I'm hoping our viewers enjoyed the opportunity to hear some stories and learn about some important topics and found insights that they might be able to apply to their daily lives. And thank you for watching. On behalf of myself, our guests, the Sisters of Mercy, and the Mercy staff, we wish you good health and humor. And until we meet again, may the road rise up to meet you. And it's time for our Wait Doctor, I Forgot to Ask segment. This is where we talk to our guests a little bit about the questions they wish their patients would ask and aren't. And maybe in this particular case, since we're talking to folks who've been on the front lines with COVID, what should patients be asking or wondering about relevant to their treatment for COVID-19, getting checked for COVID?
To me, I think the biggest thing is I wish more people would be asking if they should get vaccinated or if they should get that booster.
I agree with that as well. And I think just in general for COVID, kind of thinking about what we can do to try to normalize things. I think COVID's been around now for almost 3 years. And sometimes it seems like there's no end in sight, but how do we kind of transition from this time of the pandemic to more of a time of normalcy, I guess?
So do you think people aren't getting their boosters or maybe even getting vaccinated at all? Is it maybe because people just feel tired of it all and they just don't want to be bothered? I mean, how do you work to kind of overcome that, to encourage people like, yes, we know it's been almost 3 years and it's been a long road, but really this is your best bet for protecting your health. How do you get that message across?
Yeah, I mean, people are definitely tired of it. I think we're all a little bit tired of COVID. I think it's hard because, we've had Omicron, which wasn't fully covered by the vaccine, and there's been a lot of press about that. But the bottom line is that it's covered enough that you're not going to have severe illness if you have that vaccine and the booster. And I think that's an important message to get out there.
And from having to deal with patients who needed to be ventilated, and that is such a ordeal to go through, that if something simple as getting a vaccination can improve your chances of avoiding hospitalization, avoiding death, it would seem the thing to do. So that's a message I hope people will take to heart. And speaking of taking things to heart, our guests always get to have a show and tell, but I decided for this particular program, I would offer for a visual, these are my files from 18 months of working on COVID-19. These are all the notes from all our meetings, from the various projects that we're involved with COVID-19, from both the media perspective as well as a community perspective, various health department informations that were shared with us, donations that people made to the hospital, and everything that was involved. I don't think in my time here, and I've been here for 26 years, I've had quite so much put together dealing with one particular issue. So, it's nothing compared to what people on the front lines have to do. But at the same time, I think people should know that we were all here. Not just, people think hospitals and they think, well, that's just doctors and nurses. There's a lot more than that runs a hospital and institution. And both medical and non-medical lay people, like from the people doing the laundry and the janitorial staff all the way up to the top executives, the CEOs and everything else. We were all here and continue to be here doing what's necessary to get the message out and provide the care that people need. So I thought, as they say, picture's worth 1,000 words. This, I think, helps make that point.